Welcome to our training on enrollment periods, when and how we can help Medicare beneficiaries. The nice thing about this training and many of the trainings that we do is the fact that not only is this for you to better understand a topic, but we have a presentation here that you could do for a group of seniors at your church or at a community center, at your local YMCA or library. So it's twofold, right? As you look at this presentation and listen to what we're talking about, you can see slides that you can get and customize and use that to give a presentation yourself. Our objective for the course today is to just take a quick look at Medicare enrollment periods, including the initial enrollment period, the annual enrollment period, special enrollment periods, a couple of them here, and the open enrollment period. So through this course, you will learn some of the eligibility rules, some of the timing, and some real-world scenarios that help us to ensure compliant, accurate guidance for Medicare beneficiaries. We're going to start off with the initial enrollment period. This is one that we really like to work on as agents because this means we're getting people when they're new to Medicare. We take a look at our books of business. We see that people that we work with from their initial enrollment period are very loyal clients. They stay with us for a long time. And that's because we're entering into a relationship with them at this entry point. So super important enrollment period. It's called the initial enrollment period. And as you see these slides that I'm going through right now, the language for the most part is directly from Medicare.gov. And I do that on purpose. I want you to read guidance from the official source. I will say though, some of their wording is a little bit strange. I think it does create some of the confusion that we sometimes interact with on, but we'll try to make it as clear as we can here today. So the initial enrollment period starts 3 months before the beneficiary gets Medicare, Part A and or Part B, and it ends 3 months after they get Medicare. During that time, the Medicare beneficiary can join any plan, so Medicare Advantage, standalone Part D, or a Medigap plan, Medicare supplement plan. They will need both Part A, that hospital insurance, and Part B, medical insurance, to join a Medicare Advantage plan with or without drug coverage. They will need either Part A or Part B to join a Medicare drug plan. If you're new to Medicare as an agent and you're watching this presentation right now, go ahead and grab a screenshot of this slide or go into our agent learning community and go into the full course version of this and download the presentation, because we get asked this very same question over and over again, almost every year on AHIP in a scenario and on many, many carrier certifications. So what parts of Medicare do you have to have active in order to sign up for a specific type of a plan? I took this slide out of our Medicare 101 presentation. That is another presentation that we have here at TLC available for you. And I think it's a little more clear cut on the initial enrollment period than the way that Medicare.gov explains it. And so what the slide says is when you turn 65 or after your 25th disability check, so we added a little extra note here, you have a 7-month window to sign up for Medicare. This is called your initial enrollment period. And it's going to include the month that you turn 65, which is not something that was mentioned on that previous slide. So the month you turn 65, 3 months before your birthday month, and the 3 months after your birthday month. So as an example, if your 65th birthday is June 7th, your initial enrollment period runs from March 1st through September 30th. We have a nice little infographic here kind of charting out that 7-month window. Medicare coverage generally begins the first day of your birthday month. Special note, if your birthday happens to be on the first of the month, your coverage generally begins the first day of the month prior to your actual birthday month. So you get an extra month ahead of everybody else if you're born on the first of the month. Really important rules for us to know and to keep in mind as we interact with clients, right? So if I sign up for a plan during my initial enrollment period, that 7-month window, when does that plan's coverage begin? Well, it varies, and it's dependent on when the plan gets the beneficiary's request. If the request to join a plan is made before Medicare Part A and or Medicare Part B begin, the plan coverage will start the same day as when Part A and or Part B begin. So on that previous slide, let's go ahead and back up for a second. If I apply for my Part A and B and let's say a Medicare Advantage plan during those 3 months before my 65th birth month, my coverage in most cases will start on the first day of my birthday month. And the exception again would be if my birthday was on the first of the month. Now, maybe I was running behind and I didn't get my applications in. I didn't sign up for Part A and or Part B. Or maybe I didn't sign up for a plan until I was already celebrating my birthday. Generally speaking, if the request to join a plan is made after that Medicare beneficiaries Medicare Part A and or Medicare Part B start date, the plan coverage begins the first of the month after the plan gets that request. So let's back up to our infographic here again. So in that scenario, take a look at that big 65 in the middle of the slide here. I fill out my application for a Medicare Advantage plan during my birthday month. My coverage would start the first day of the following month. And the same pattern would follow suit for the remaining months in this 7-month window. If I applied for my plan in the month after my birthday month, coverage would begin generally the first day of that following month. Very rarely, at least in my experience, do we encounter people who blow through this initial enrollment period. I'm not going to say it never happens, but we do a lot of work to try to get in front of people who are aging in and to do a really good job as advisors at setting these expectations about these timelines. There are other times where you will come across individuals who are going to only be applying for Part B. And these are typically people that have worked past 65 or their spouse continues to have coverage through an employer. And so maybe they only took Part A when they were initially eligible at age 65. As we know, Part A is generally premium free so long as me or my spouse has paid into Social Security for 40 quarters. So you will have people that have other coverage, right? Creditable coverage that meets those federal guidelines who will continue to be on that coverage beyond their 65th birthday. And so they may come to you and already have a Medicare ID card with a Part A effective date, but you will not see a Part B effective date. Those individuals can then go ahead and apply for Medicare Part B only. And we have some resources that we can provide to you to help you walk those individuals through that process. So they have an initial enrollment period specific to being new to Medicare Part B. That enrollment period starts 3 months before the month the individual is first eligible for both Part A and Part B, and it allows 2 months after the beneficiary gets both Part A and Part B for the first time to join a plan. Now, there are certain circumstances that might make this window a little bit different than what you're reading on this slide, which is directly from Medicare.gov. So we'll talk a little bit later about special enrollment periods in some places where you can find really accurate and scenario-based information on some of these special enrollment periods, like losing employer coverage, which is typically the case when we're helping someone apply for Part B only. So when someone is picking up Part B, again, now they have the opportunity to join any Medicare Advantage plan with or without drug coverage. And again, a little misleading, if you look at the table for enrollment periods on Medicare.gov, the chart where it says what Medicare beneficiaries can do in this enrollment period, it only states join any Medicare Advantage plan with or without drug coverage. However, if you do a little bit of digging in Medicare.gov, you'll also find the statement that your Medigap open enrollment period will start once you sign up for Part B. So sometimes we do have to go a little bit deeper beyond one page on Medicare.gov. And we can also reference AHIP in the AHIP content, or maybe you use the NABIP certification. We can reference the content from our annual certifications to get clarity on some of these guidelines when it comes to enrollment periods. Let's segue into the enrollment period that is by far the most heavily marketed, the most television commercials, and really the busiest time of the year in our industry. And this is what's called the annual enrollment period. The annual enrollment period runs in the fall from October 15th through December 7th. Now, during this enrollment period, individuals can make changes typically to the plans that they currently have. It can be very busy as people are coming in to evaluate their options. And the real reason for this time of year is we all know that the carriers are allowed to make adjustments to their plans for the following plan year. And those plan changes go into effect each January. So the annual enrollment period gives us that window of time to help make sure our clients and potential clients are really informed about their plan options. So during this season, we cannot submit applications until October 15th, and the last day we can submit applications is December 7th. Our clients, those Medicare beneficiaries, if they have a Medicare Advantage plan, they can change to a different one. They can drop that plan if they so choose. So we can help them evaluate the benefits of their current plan against other plan options that may be available in their area, both Medicare Advantage plans, and if they meet eligibility criteria, they could also look at going to a Medicare supplement plan. We'll talk about that in a moment. They can also change their standalone drug plan option. So they can take a look with us. We can go into Smart Enroll, put their medications in, do that side-by-side comparison to see how their costs may look with a 12-month keyword estimate. When we show those clients in these meetings, their estimated pricing, we want to make clear that that's an estimate. While it's typically very accurate, if we say this is exactly what your medications are going to cost, we're running the risk. We're trusting software, we're trusting technology to help us give them that 12-month estimate. But they can easily do that. They can come to you, review their drug plan, and switch, drop, or join another Medicare drug plan if they so choose. Also, during the annual enrollment period, your client can change their coverage model entirely. So they can switch from original Medicare to a Medicare Advantage plan or go from a Medicare Advantage plan back to original Medicare. So there's a lot of options during this season. The caveat though, right? If I've been on Medicare A and B for 6 months, most Medicare supplement plan carriers are going to require that I go through additional underwriting beyond that point. And again, this depends on the state that you live in. We're going to touch on that in a little bit, but that can be one of the harder transitions to make. Once I've been on Medicare A and B for 6 months, for me to go from original Medicare for me to go from a Medicare Advantage plan to original Medicare with a Medicare supplement can be a little bit difficult because of the underwriting that Medicare supplement plans are allowed to do in many instances. So if I make a change during the annual enrollment period, when does that change go into effect? Generally, January 1st. And I'm saying generally because we're going to dive into that in a moment here. So January 1st for the MAPD, Medicare Advantage Prescription Drug Plan, and PDP, Prescription Drug Plan changes. If I make those applications through, hopefully you, right, using Smart Enroll or a carrier site during that enrollment period, October 15th through December 7th, those changes take place January 1st. If they do not already have a standalone drug plan and they're switching to a Medicare supplement plan during AEP, keep this in mind. Maybe they qualify. Maybe they're a very healthy 68-year-old. They want to leave Medicare Advantage plans and go back to original Medicare. When you do your Medicare supplement application, let's say October 25th, it's a little bit different with a Medicare supplement application. You could technically choose December 1st for that plan effective date on that application. Whereas when you're doing standalone drug plans for the most part or MAPD plans, using an AEP enrollment period is automatically going to place that business and that start date into January. So we do need to be cognizant of that if we're filling out a Med Sup application for someone who is going from a Medicare Advantage plan back to original Medicare, and we do not have any special enrollment period options to allow a standalone drug plan to start, say, December 1st or November 1st. We kind of have to make sure that that med supplement plan also begins January 1. One other warning here about the annual enrollment period. Had this happen to myself a couple times. If you meet with people who are aging into Medicare during the annual enrollment period, so let's say I'm new to Medicare, turning 65, and my birth date is November 7th, so my plans will go into effect November 1st, right? Yes, we're helping them during the annual enrollment period, but that is an initial enrollment period option that we're going to be using. And we need to be careful, especially when it comes to prescriptions. We don't want to make the mistake of only looking at the plan option for them for that 11/1 effective date covering the last 2 months of the current year. We may also have to look at options for them in January and make sure that the plan that we're putting them on for 11/1 is still the right plan for them in January. So there are instances where we have to do 2 applications for clients when they're new to Medicare during the annual enrollment period, and that plan that we put them in that's going to be good for 2 months maybe is not the best choice in January. Just a real important thing to keep in mind. So I think this is a really important slide here yet again. Very often on certifications, we're asked about how do plans automatically cancel versus not. And so here's a slide to kind of help clear that up. Generally speaking, there's automatic cancellation. So if I am a Medicare beneficiary and I change Medicare Advantage plans, MAPD to MAPD, that is an automatic cancellation. So I'm on a plan this year, I'm changing to a plan in January. Effective January 1st, the new plan begins, the old one ends, simultaneously, automatic cancellation. The same is true generally, prescription drug plan to prescription drug plan. The same is true generally, Medicare Advantage prescription drug plan to standalone prescription drug plan. And there's some other case examples here. Typically speaking, if that plan has a Part D component and I change to another plan with a Part D component, that's very often going to be an automatic cancellation. Here's the big caveat. Medicare supplement changes are typically not automatic cancellation. So if I'm on a Medicare supplement plan and I'm leaving it for the first time to go to a Medicare Advantage plan, I have to make sure my client calls that Medicare supplement carrier and proactively cancels that coverage. We run into people all the time who have both a Medicare Advantage plan active, and unbeknownst to them, until we sit down and figure it out, they simultaneously are paying for a Medicare supplement plan. We do not want that to happen with any of our clients, so we have to advise them on these cancellation rules. The same would be true if I go from a Medicare Advantage plan to a Medicare supplement plan. That is generally not going to be automatically canceled, right? So I might have to call that Medicare Advantage carrier and cancel it. The exception here, though, is, and hopefully this clears it up, if someone is going from a Medicare Advantage plan to a Medicare supplement plan, we as agents are going to do our best to also enroll them in a standalone prescription drug plan. And that piece would result in that existing Medicare Advantage plan being automatically canceled. So let's transition to January. And this is an enrollment period called the Medicare Advantage Open Enrollment Period. It runs from January 1st through March 31st, or within the first 3 months of an individual getting Medicare. During this time, a Medicare beneficiary can switch to another Medicare Advantage plan with or without drug coverage. They can drop their current Medicare Advantage plan and return back to original Medicare. During that transition back to original Medicare, the beneficiary will also be able to join a separate standalone Medicare prescription drug plan. So this is a unique enrollment period window, January 1 through March 31. And it's a time where we can help clients make plan adjustments from maybe they got bad advice during the annual enrollment period, or maybe their prescription coverage didn't turn out to be what it was told to them by a platform or by an agent that they met with. Maybe their estimate for their prescriptions was very wrong. Maybe the agent that they met with failed to do a really good network check and 3 doctors that they really care about are not in their network. The one thing we have to keep in mind, and I think it's on the next slide, I'm going to go ahead and advance. Yes, it is. So when they make these changes, January 1 through March 31, the new coverage begins the first of the month after the plan gets the beneficiary's request. Meaning I make the request in January, the plan application is submitted. As long as it's submitted in time, that new coverage will begin February 1st. And the same is true for both February and March. That coverage would begin the first of the following month. Here's this note I wanted to get to. Contributions towards the member's current maximum out of pocket for medical do not carry over to the new plan. And that's why I have noted here for Part A and B expenses. So if I have spent a lot of money on copays and coinsurance in January and February, and I'm already getting close to my plan's max out of pocket for medical, Part A and Part B expenses, it's probably not in my best interest to change plans during the Medicare Advantage open enrollment period, because that's going to reset and it could end up costing me significantly more. However, they do roll over those contributions for Part D expenses. So this year we have the ceiling established by the government for Part D. If I've already spent $1,000 towards that, that's going to roll over to my subsequent plan. Super important little note there. So I didn't put all of these in here because it would make it a very, very lengthy, like multiple hour long presentation. But let's just touch on a few special enrollment periods. Again, pulling the language directly from Medicare.gov. So one special enrollment period you may encounter is moving. And what happens is the beneficiary, your client, moved to a new address that is not in their plan's service area. When that happens, they get a chance to switch, and it begins when they move, and it continues for 2 months after they move. Now, if they tell their plan before they move, their chance to switch plans begins the month before, and then they still have those 2 months after to initiate that special enrollment plan change. You are going to encounter this. And by all means, please never tell your client that you're not licensed if they're changing states and just have them go talk to another agent. Please reach out to us at TLC and let us help you with that. We can either help you get licensed if it's in your best interest, or someone here can help that client and work something out with you to make sure that you're maintaining that opportunity to serve that individual. Many states, it is not difficult to get licensed in. There are a handful that make you jump through hoops. But if you look at this window of time, as long as your client's communicating that move to you in a timely fashion, we do have a little bit of wiggle room here to go get that additional state license. So if they make that move, what's going to happen? They can switch to a new Medicare Advantage plan with or without drug coverage, or a Medicare drug plan. So I'm going to go back one slide. Some of these special enrollment period rules vary greatly from state to state. There are a lot of state rules that impact Medicare supplement plans in particular. Some states, if you're new in the state, you get a guaranteed issue right to get a Medicare supplement plan. So it is very beneficial to you to spend a little bit of time in your state, and really every state that you serve, looking up the actual law. Okay, so in Ohio, we have the Ohio Revised Code. You can go to the Ohio Revised Code website. You can type in Medicare and Medicare supplement plan, and you can browse through the actual laws in the state that pertain to the industry that we serve. You can also sometimes find really nice fact sheets on the Department of Insurance websites about specific state rules. So just please bear that in mind, right? That all of these rules can be a little bit different in certain states. Let's touch on plan exits here for a moment. We had a lot of these this year, right? Plan terminations, plans leaving service areas entirely. And so there are special enrollment periods for our clients when some of these things happen. So here's the language from Medicare.gov on a plan exit, which they define as the plan ends its contract with Medicare or the plan and Medicare agree to end the contract. When that happens, your client, that Medicare beneficiary, is given a chance to switch. And it starts 2 months before the plan's contract with Medicare ends, and it runs 1 full month after that contract ends, giving them that special enrollment period. During that enrollment period, they can switch from their current Medicare Advantage plan or Medicare drug plan to another plan option. The beneficiary, if they do not change, right? Let's read this sentence as it's written by Medicare.gov. The beneficiary will be enrolled in original Medicare if they do not join another Medicare Advantage plan before their current plan ends. So this is where, when we know a plan's ending, it's super important to communicate to our clients who are on that plan. Even though they're going to get carrier communication, we need to communicate and say, hey, we want to sit down with you and go over your options. The plan that you're on is no longer going to be available to you in the following year. If we don't do that and they don't read their mail and they don't take action, they will just go to straight Medicare A and B, and that'll be all that they'll have for coverage. So super important that we keep an eye every year, late summer into early fall, on plan exits and inform our clients accordingly. So you will encounter this one very frequently: loss of employer coverage. The what here is the beneficiary left coverage from their employer or union, including COBRA coverage. This gives them a chance to join that lasts for 2 full months after the month their coverage ends. And during that time, they can join a Medicare Advantage plan or a Medicare drug plan. Very oftentimes, they can also pick up Medicare supplement plans and standalone drug plans. There's also this special enrollment period that's known as the trial right. So the what here is a client dropped a Medicare supplement plan or a Medigap policy for the first time, and then the member joined a Medicare Advantage plan. So they left a Medigap plan to go to Medicare Advantage. If they're still in their trial right and they become eligible for guaranteed issue of a Medigap policy. So their chance to drop their Medicare Advantage plan and return to that MedSup guaranteed issue lasts 12 months after they join that Medicare Advantage plan. The key words here are for the first time. So for someone to use the trial right, they have to have started off their Medicare journey on a Medicare supplement plan. I'm on a Medicare supplement plan. I want to give a Medicare Advantage plan a shot. I try it for less than 12 months, and then I decide I want to go back, guaranteed issue. So they can drop the Medicare Advantage plan and enroll in original Medicare, and then they have a special right to buy that Medigap policy. There are many more. There was a season here where we had a lot of 5-star plans, and we actually moved people when there was some pretty contested hospital negotiations taking place with carriers. You will see people that lose or gain Medicaid eligibility, and those special enrollment periods centered around that. People in long-term care facilities have special enrollment period options. Losing extra help can necessitate a special enrollment period. There are many, and this is something that we all have to spend a lot of time diving into and keeping up to speed on. So in this presentation, we have a link here to a website. If you can't click on the link because you're maybe just watching the YouTube version of this, just go to Medicare.gov and enter in the words special enrollment periods in the find. It'll bring you to 3 or 4 really good, incredible resources to help you with that. I do want to end this by talking just for a moment, because again, this could be another hour-long presentation. There are states now that permit guaranteed issue moves in the months surrounding a member's birthday for Medigap plans. And the rules can vary significantly from state to state. But the general idea is, in most of the states that permit this, they will say you have 60 days in and around your birthday. Some states, it's 30 days before your birth month or your birthday and 30 days after. Some states, it is 60 days, including your birthday, and then the 60 days that follow. It's actually 61 in some states. Other states will say it's 60 days from the day of your birth, and a total of 60 from that point. We have a birthday rule cheat sheet for you. Again, if it's not able to be clicked on your version of this presentation that you're watching right now, and you can reach out to marketing@tlcinsuranceGroup.com. You can also find that in Agent Hub. It should be there once we get this new website up and running, and hopefully you're watching this and you can go grab that birthday roll cheat sheet right in TLC Agent Hub under the sales resources. But dive into that birthday roll concept. Make sure you know if there is a birthday roll or an anniversary roll, or in states like New York, some nuanced open enrollment rules that pertain to Medicare supplement plans that'll help you really serve clients well where you live. That is it for this presentation. And if you want a copy of this, again, there's our contact information. Feel free to reach out to us at marketing@tlcinsurancegroup.com. Keep learning about enrollment periods. You should be going over this information annually through all your certifications. But we hope this presentation was concise and helpful. And like I said at the very beginning, maybe you want to take this presentation and modify it a little bit and then use this to do talks to groups that might be a good opportunity.